Chairman yields back and now recognize Mr. Crowley for his 5-minute opening statement.
Great, thank you very much, Chairman Griffith, Ranking Member Castor, Chair McMorris, Rodgers, Ranking Member Pallone, and members of the subcommittee. Thank you for the opportunity to present these comments to the committee as it examines the very real-world and negative effects that certain provisions of the Inflation Reduction Act are having on biomedical innovation and the chilling and immediate effect it is having, especially on smaller, entrepreneurial biotechnology companies in the United States. I'll also comment on the negative effects the law is having on patient access to novel, often life-saving therapies. My comments this afternoon focus in particular on the field of rare disease research and drug development, as well as the IRA's disincentives to continue to invest in important small molecule technologies. My testimony comes from a very personal perspective and unintended journey into the world of science and medicine. 25 years ago, our family's life changed. First, our then 15-month-old daughter, Megan, was diagnosed with Pompe disease, a rare and fatal neuromuscular genetic disorder. Weeks later, we received the news that our 1-month-old son, Patrick, also had Pompe. We were devastated to learn that most babies with this disease died before the age of 2, and that few lived to be kindergartners. Over the next 2 years, Megan and Patrick got progressively weaker, needing wheelchairs to maneuver and ventilators to breathe. Finally, realizing that time was our greatest challenge, I quit my job, took a home equity loan and cash advances on our credit cards, and together with a pioneering researcher, I co-founded a small biotechnology company to develop a medicine for Pompe. Despite many setbacks, with the remarkable work of so many, we succeeded. Megan and Patrick began to receive a life-saving enzyme replacement therapy in early 2003. It has saved their lives. They are now 27 and 26 years old, and despite the ravages of the disease from not having a medicine for the first years of their life, Megan went on to graduate from the University of Notre Dame and earn a master's in social work degree from the University of North Carolina. She works now at the Make-A-Wish Foundation. Patrick now works in a flower store staffed by all people living with disabilities. While our family's journey has received much attention, we are not alone. What science and medicine provided to our family and continues to provide is hope. Millions more living with rare, devastating diseases need that same hope today, and they need it really fast. There are nearly 10,000 rare diseases. Collectively, they afflict almost 30 million people here in the United States. About 95% of these disorders have no treatment, and many are not even being researched. This is a public health crisis of epic proportions. Thankfully, though, we are on the dawn of a golden age in genetic medicine. Exciting new therapies like gene therapies, gene editing, precision-based small molecules offer hope today where for so many, for so long, there has been none. We should be constantly seeking ways to encourage massive private capital flows to fund biotechnology companies and entrepreneurs. We need to incentivize our largest biopharmaceutical companies to invest in these rare disease programs. Simply stated, we need to do all that we can to break down barriers and to accelerate research and development. But now, rather than declaring a public health crisis and applying an Operation Warp Speed for rare diseases, we face a new headwind with the IRA. The development of new medicines takes many years of research and faces long odds of success. At our company, Amicus, over the years, we have had many more programs and clinical studies fail than succeed. Drug discovery broadly and rare disease research especially are inherently filled with tremendous risk. But at Amicus, we would rather be the first to fail than the last to succeed. All this comes at a time, together now with the IRA challenges, that have been the most difficult 2.5 years in the history of the biotech industry. There are 3,000 biotech companies in the United States, the vast majority of which have no approved products or revenues, let alone any profitability. These companies, though, originate more than 75% of all new medicines. We are the cradle of biomedical innovation, and the American biotech sector is the envy of the world and an incredibly important strategic advantage for our nation. But as emerging entrepreneurial companies, so many now are struggling. Access to private capital needed for research and development is difficult. In the rare disease space alone, more than 100 clinical programs have been canceled in just the past 18 months. We cannot squander this great opportunity in the years ahead to advance the state-of-the-art medicines for people in need, especially the most vulnerable among us. And the United States must not relinquish this great strategic advantage that is American biotechnology. Thank you.
Thank the gentleman. Now recognize Dr. Kesselheim for his 5-minute opening statement.
Chairman